Hello and welcome. I'm Dr. Ryan Kazemi, and it's great to have you with us today. One of the most common questions that I get from patients with dental implants is gum recession, which often results in poor aesthetics and potentially discomfort. And if it's left untreated, it can eventually cause compromise of the implant itself and also potential loss of the implant altogether. So in this video, I'm going to talk about gum recession, how it happens, and what you can do about it. So let's first talk about what gum recession is and what it looks like. Now, natural teeth and dental implants should normally be surrounded by healthy bone and attached gum tissue. So any type of loss of bone or gum tissue can compromise the support and result in either periodontal disease when it involves natural teeth or peri-implantitis if it happens around dental implants. Now, what are some of the signs that a gum recession may be happening? First, you might start to notice the shifting of the gum tissue line. Also, you might also notice a grayish color around the gum tissue as the implant abutment or the implant itself becomes more exposed and more visible. Additionally, you might experience pain or discomfort as inflammation develops. So there are primarily three leading causes of gum recession around dental implants. The first is patients with very thin gum tissue who are already more prone to a recession simply in response to just normal eating function and brushing. And as the gum tissue recedes, so does the underlying bone, and hence continued loss of support. The second common cause is lack of or inadequate bone around dental implants. And in these cases, the gum tissue recedes as it follows the underlying bone. And the third common cause is simply poorly positioned implants with excessive tilts or angles, which also result in loss of bone and gum tissue. So what are some of the treatment options for receding gum tissue around dental implants? Well, the treatment options depend on the health and position of the implant, the amount of the available bone, and also the degree of gum tissue recession. So treatments can range from performing a gum graft all the way to removing the implant altogether and then restoring the bone and the gum tissue that's missing and eventually replacing it with a new dental implant. So we're going to take a look at two patients today, each one of them with a different type of gum recession and cause, and I'll show you how they were treated. So this patient came to us with a gum recession around the outer aspect of the lower dental implant that had been gradually developing over the last 2 years. He was complaining of constant discomfort, and although it wasn't visible when he smiled, he was quite concerned about how it looked. And here we can see the gum recession with the exposure of the implant and the abutment and quite a bit of inflammation around it. And when we look at the cone beam CT scan from a cross-sectional view of this implant, it appears that the implant was quite poorly positioned, and it was a very thin amount of bone that was covering this outer aspect. So if you look at all the factors that may have led to the gum recession in this patient, these may include a thin amount of bone on the implant, second, a very poorly positioned implant, and also the presence of this muscle attachment known as a frenum, which causes tension to the gum line. So in this case, with a relatively healthy implant and supporting bone, I chose to restore the missing gum tissue around the implant following a staged treatment protocol. So let's take a look at our treatment strategy in this patient. The first step was to remove the existing crown and the abutment and simply place a cover screw on the implant. Now in this particular case, because this implant was so old, we could not find the appropriate cover screw, so we simply just left it open. Then we let the gum tissue heal and regenerate itself as much as possible over a 6 to 8 week period. The second step is to perform a gum tissue graft using tissue from patient's palate and also a procedure known as frenectomy, which allows us to reposition the muscle attachments and eliminate that tension on the gum tissue. And here's the patient after about 3 months of healing with a restored, thick, and a good keratinized gingiva covering the dental implant. Next, we expose the implant and place a temporary healing abutment. And this is done in a way to make sure that we have a thick and attached gum tissue on both sides of the implant. And finally, after about 8 weeks of healing, a new restoration with a customized abutment is delivered. And here's the before and after showing the remarkable outcome in this patient. So what are some of the benefits of this particular treatment approach? Well, first, we were able to effectively transform the biotype of this gum tissue from thin to thick. Second, we were able to develop a very good zone of attached gingiva, which is quite resilient against recession and also provides more protection to the underlying bone and implant. Third, we were able to eliminate the muscle tension on the gum tissue from the frenum attachment. Next, we're also provided more stability of the bone and the implant by having a thicker gum tissue, and also eliminate potential peri-implantitis and bone loss. Okay, so now let's take a look at our second patient who also presented with significant amount of gum recession around an implant, but with an entirely different condition and treatment possibilities. So this patient also had chronic pain around his upper front implant and a gum recession that was initially covered with the crown itself. But it never really looked great, especially since this tooth was right in the center of his smile zone. So when we look at the cone beam CT scan in the cross-sectional view, we see that the implant was placed with a significant tilt and there was virtually no bone on its outer aspect. So unlike the first case that I showed you, a gum graft will not work in this patient. The implant itself simply needs to be in a better position, and it also has a significant bone deficiency. So let's take a look at our treatment strategy in this case. The recommended treatment for this patient was to remove the dental implant altogether and then restore the missing bone and gum tissue and then place a new dental implant using digital workflow and computer-assisted planning for accurate placement. So the first step was to remove the crown, the abutment, and also the implant itself using a reverse torque technique, which is a very conservative approach in removing failing dental implants. Next, we clean the area and then place a platelet-rich fibrin membrane, which is obtained from patient's own blood, and this really helps to promote the gum tissue healing and let it mature for the next 3 months. And here's the patient after 3 months of healing. The gum tissue has matured quite nicely, and of course we have a ridge and a bony defect that we need to address before replacement with a new dental implant. Next, we'll perform a bone augmentation surgery in order to restore the moderate amount of horizontal and vertical deficiency as much as possible. So for bone grafting in this patient, I used a guided bone regeneration technique using a combination of patient's own bone and also some bank bone material. And here's the patient after 6 months of healing. Now that we've developed the site, we're ready to proceed with placement of a new dental implant. So for optimal accuracy and precision, we're going to take a cone beam CT scan and also a digital impression that are then merged into a software for virtual implant placement surgery and planning. And all this information is then sent to a 3D printer to fabricate a surgical guide. And here's the patient with the augmented site and also the surgical guide that was fabricated using the 3D printer. and we're going to use this guide for a fully guided implant placement. The dental implant is placed and simply allowed to integrate for about 3 months. Next, we fabricate a prototype restoration, which is really made to help sculpt the surrounding gum tissue, and then finally followed by delivery of the final ceramic restorations. And here we see the complete restoration of the bone and gum tissue and a final outcome with excellent aesthetic results. So I've shown you that correction of gingival recession around dental implants is certainly possible. But still, the best approach is to simply prevent it to begin with. And this is only possible with careful planning, proper site development for the implant, and also a well-orchestrated and a well-executed surgical and restorative treatments. If you enjoyed this topic, please subscribe to our channel and join us again for other upcoming programs. I'm Dr. Ryan Kazemi. We'll see you again very soon.